Hello everyone, today we have a couple of mnemonics that will help you remember a couple of points in the head and neck anatomy. Branches of facial nerve are temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. How you can remember it? You can remember it by remembering this mnemonic. The zebra bite my cheek. There is a well-known mnemonic that the zebra buggered my cat. This one does make more sense. The T in the is for temporal branch. Zebra, the Z for zygomatic branch. Bite, B for buccal branch. My, M for marginal mandibular branch. Cheek, C for cervical branch. The word cheek will remind you of the facial because the cheek is in your face, right? So this makes more sense. Scalp layers are skin, connective tissue, aponeurosis of occipitofrontalis muscle, loose areolar tissue, temporalis muscle, and periosteum. How you can remember this one? You can remember it by remembering scalp plus temporalis. S for skin, C for connective tissue, A for aponeurosis, L for loose areolar tissue, B for periosteum, and T for temporalis. The temporalis muscle is before periosteum. Content of cavernous sinus are oculomotor, cranial nerve, trochlear, ophthalmic nerve, maxillary nerve, and abducens nerve. How you can remember this one? You can remember it by remembering 3, 4, 5, 1, 5, 2, 6, and ICA. 3 for oculomotor nerve, 4 for trochlear, which is the fourth cranial nerve. 5-1 is for ophthalmic nerve, and 5-2 is for maxillary nerve. And 5-1 and 5-2 are branches of trigeminal. And 5-3 is mandibular nerve, as you know. 6 is abducent. And 5-3 is mandibular nerve, as you know. Mandibular nerve we cannot involve it here because it does not go through the cavernous sinus. And it does make sense. Mandibular is the lowest branch of the trigeminal nerve. There is no way for the mandibular nerve to go through the internal cavernous sinus. 6 is abducens nerve. ICA is internal carotid artery. So 3, 4, 5, 1, 5, 2, 6 plus ICA. Bird cavernous sinuses. This is not an easy one. They are sphenoparietal sinus, cavernous sinus, middle meningeal vein, inferior petrosal sinus, and superior petrosal sinus, sigmoid sinus, transverse sinus, and petrosquamous sinus. How you can remember this one? You can remember it by remembering this phrase. Middle-aged, smart, sophisticated couples take interesting bet program to stay to stay married, basically. Middle-aged, smart, sophisticated couple take interesting bet program to stay paired. Middle for middle meningeal vein. The S in the smart for sigmoid sinus. The SBH in sophisticated for sphenoparietal sinus. The C in the couple for cavernous sinus. T for transverse sinus. Interesting, the I is for inferior petrosal sinus. And as you can see, interesting bet program. So inferior petrosal sinus and superior petrosal sinus. And the word bet will also remind you of petrosquamous. So bet for petrosal, superior and inferior petrosal sinus, and also for petrosquamous sinus. Unpaired cavernous sinus are superior sagittal sinus, inferior sagittal sinus, occipital sinus, cavernous sinus, anterior intercavernous sinus, posterior intercavernous sinus, stress sinus, and basilar cavernous sinus. How you can remember this one? You can remember it by remembering this phrase. Straight occipital line unpair, which means divide, unpair the head base into superior and inferior segment and pass inside the cavernous. So we have a line, straight occipital line, amber, which means divide the head base into superior and inferior segment, and this line pass inside the cavernous. So straight for straight sinus, occipital for occipital sinus, amber for the mnemonic, amber cavernous sinus, the head base, the word base for basilar cavernous sinus, into superior and inferior sagittal sinus. The S in segment is for sagittal. The two words before it, superior and inferior, is for superior and inferior, and the S for sagittal sinus. The A and the B in an and pass, as is shown in the screen, is for anterior and posterior. The word inside is for intercavernous sinus, and the word cavernous for cavernous. And as you know, we included inside the cavernous to indicate it is intercavernous. The cavernous sinus is paired, as we showed in the previous screen. I hope this is helpful for you. Please, if you like, give it a thumb up, subscribe to our channel. We're going to continue and we're going to finish the anatomy for the MRCS. We will try our best to make the most logical mnemonics, because anatomy is not easy to memorize. Good luck with your study and your exam. Thank you.